I heard you have a special kind of surgery.
Oh, do you have?
I have my complice here.
I see. Actually, next week will be a big surgery. Next week, Friday, I'm going to do total hand transplant. What does mean? Does mean I have a. Shall I say you or it
Yes,
please.
Please
Okay.
tell me. I'm really curious.
Okay, I have a young man. He lost his thumb from this level. Yeah, from this level he lost his thumb from a accident, and now he cannot use the hand like forefinger. He have the finger movement, but he cannot grasp. He cannot move
He
it.
cannot use his hand to
totally.
take something, yeah?
It's mean when you lose your thumb, you lose 50% or 60% of your hand function. So it's very important, especially right hand.
For somebody who is healthy, it's very hard to imagine even what
The fingers does.
what the fingers does in fact, and how it's working the whole hand together. So you simply cannot do this if you don't have.
Of course, you cannot eat. You cannot like open your door with key. So it's really very difficult life.
Recep Bey, yaşınızı öğrenebilir miyiz?
36 yaşındayım.
36 de ani.
36 de ani și ești într-un moment dificil din viața ta, dar peste care vei trece cu bine, sunt sigură.
Ve şu anda hayatınızda zor bir dönemdesiniz ama eminiz bunu da atlatacaksınız.
Pentru că ești astăzi pe mâna unui doctor foarte bun.
Çünkü bugün iyi bir doktorun ellerindesiniz.
Ce s-a întâmplat? A fost un accident, cel care te-a adus în situația de a pierde un deget de la o mână?
Bu kazayı nasıl geçirdiniz? Ne oldu?
Kazada gece vardiyasında makine operatörüydüm.
Era muncitor de noapte, operator la mașină.
Makinenin içine presli bir makineydi bu.
Avea o presă această mașină.
Bir parça sıkıştı. O parçayı almaya çalışırken elim preste sıkıştı.
S-a rupt o parte din mașină și când a încercat să o ia, atunci s-a pierdut un deget.
Viața ta a devenit viața unei alte persoane. Practic, știu că nu te regăseai în noua ta viață. Cum s-a schimbat în cele mai mici fapte și gesturi zilnice?
O kazadan sonra nasıl hayatınız, yani değiştiğinizi biliyoruz. O hayattan sonra hayatın değiştiğinizi biliyoruz ama nasıl olarak değişti? Yani günlük işleri, hangi işlerinizi yapamıyorsunuz tam olarak?
Şehri değiştirdim. O şehirden ailemin yanına dönmek zorunda kaldım.
În primul rând și-a schimbat orașul, s-a întors la familia dânsului, nu mai trăiește în acel oraș.
N-a mai putut munci, probabil
Niye
în același
hayatınızı
loc.
değiştirdiniz? Orada çalışmaya devam edemediğiniz için mi?
Evet, iş yerinde bazı sıkıntılar oluştu. Yani daha çok
La locul de muncă au
ilgilenmediler.
fost niște probleme, nu a fost băgat în seamă și ve ondan sonra mı geçmek zorunda kaldın? Yani tekrar bir iş olanağı sağlamadı size.
Sağlanmadı.
Nu, deci nu i-au mai dat un post de muncă încă o dată. Și a fost nevoit să se întoarcă la familie, la părinții lui.
Mă interesează, pare un lucru minor. Până la urmă, în rest ești sănătos, lipsește un deget de la o mână, sigur, e un lucru greu de suportat, dar pare că n-ar fi o dramă atât de mare ca în cazul pierderii unui picior, să spunem, da? Și totuși, domnul doctor ne-a povestit cât de dificilă e viața de zi cu zi, în cele mai mici amănunte, doar pentru că lipsește acest deget de la mână.
Dışarıdan baktığında hani sadece bir parmak eksi, hani minor gibi görünse de yine doktor söyledi ki ne kadar zor olduğunu, hani günlük işleri yapamazsınız, çok zor olduğunuzu söyledi. Hani bir parmak.
Yapamıyorum mesela.
Nu poate să țină cu mâna ca cealaltă, în primul rând, dar nu poate să prindă. Nu poate să se încalțe.
Bunun gibi bazı şeyleri gerçekleştiremiyorum yani. Tabii ki zorlukları çok.
Deci lucrurile de acest fel nu poate să le facă, este foarte greu, ori dacă este ceva minor, se pare de afară.
Astăzi
Bugün
va avea loc o mare schimbare în viața ta.
bugün hayatınızda çok büyük bir değişiklik olacak.
Urmează între 8 și 10 ore în care vei dormi și în timpul acela acest medic extraordinar va reconstrui practic acest deget.
8-10 saat süreyle uyuyacaksınız ve bu muhteşem doktor tekrar parmağınızı rekonstrue yapacak yani.
Pornind de la degetul tău de la picior, da? Văd deja desenul
Ayaktaki parmağınızda
făcut. Cel de-al doilea deget de la
koyacak
picior va fi
ikinci parmak.
transformat în degetul mare de la
Yani
mână.
nakli olacak ikinci parmak elinize.
Ai încredere, domnul doctor? Ți s-a explicat cu lux de
Güveniyor musunuz?
amănunt
Her şey
ce se va
anlatıldı mı
întâmpla?
size?
Evet, çok güveniyorum. Buradan önce daha araştırmıştım ben bu an.
Are încredere foarte mare și înainte să apeleze aici, a făcut investigații foarte multe despre acest doctor.
Şükrü ve işte buldum sonunda. Doku canlandırması yaptı 11. ayda buraya.
Întâi a fost transplante țesuturi
Bir ay boyunca
în luna
kasığımda
noiembrie.
kaldı. Kasığımda
A
kaldı.
așteptat o lună
Ve daha önce şöyle bir ölü deri vardı burada.
pentru că înainte erau țesuturi moarte în
Üşüme
locul
yapıyordu
respectiv.
soğuk havalarda.
Îți mulțumesc tare mult. Îți doresc
Çok çok
succes.
teşekkür ediyorum.
Mă bucur că te văd
şans.
zâmbind cu speranță.
Çok
Teşekkür
mutlu
ederim.
sizi güldüğünüzü görmek çok mutlu oluyor.
Și aștept cu drag să te văd după operație, zâmbind la fel de încrezător.
Ameliyattan sonra görmek istiyor sizi aynı
İnşallah.
yüzündeki tebessümle birlikte.
Îți ținem pumnul. Da?
Bol şans.
Teşekkürler.
We just talked.
Okay, thank you.
Nice to see you again. He was explaining me very good what it will happen, and as I told you, he's really energetic this morning. He's very optimistic. But I would like to know some technical details to understand, as any ordinary person can understand what means, in fact, the complexity of this surgery.
So you know, you have already talked to Recep, and he lost his thumb finger and thumb during his work, and with thumb loss he cannot use this 50% function loss. The hand, he lost the function. So now I am going to do a transfer from his foot finger, bring it to here to make a finger like this, that he can use his finger. I'm going to bring the finger with all complex tissues, like nails have to be there, joints, all the finger, with nerves, tendons, and vessels.
How do you make the link? How do you
Okay.
bring him
Okay.
to be alive again, this finger?
In the first step, I will open here and then find here the vessels that I am going to make the anastomosis, the vessels that I am bring here. Maybe I'm going to use these vessels here, and also tendons here for movement, that he can make like this position, he can make this, he can make this. For tendons, I have to find here, because when he has a cut here, the tendons go up. I have to find the tendons here and then bring down. And the second part, during the operation, I am going to take the second finger. Sometimes we take the first finger. First finger we take when the patient lost his finger from this level. When patient lost their finger from this level, then we use the thumb, this finger. But if patient lost the finger like here, in this position, we use the second finger. Because this joint we need to put here as a joint here for the function. In the children, when the children they have not the finger, sometimes congenital hand anomalies, children have also loss of the finger. With finger, usually we use the second finger, yeah, from here. And here we will take the skin here and part of skin here and all the tendons, all the vessels, two vessels, artery and vein, and also nerves from here. And all we bring here. First we fixate the bone here, the bone fixation, After that, we do the tendons fixation, and after that, we do the microsurgery, the vessels together, 1 millimeter of the vessels.
diameter.
Diameter of the vessels we put together and then make microsurgery. Also the nerves that he can feel.
How many vessels are approximately to rebuild?
We will anastomose one artery, maybe 1 or 2 veins, and 2 nerves. Totally 4 or 5 vessels we are going to make anastomosis.
In fact, this procedure is very complex and it takes a lot of time during the operation, isn't it?
It takes like 6 or 8 hours. It depends of the injury of here. I don't know what I'm going to find here, because when he has the amputation, after amputation he has replantation, the vessel already used before. And I don't know how much trauma the vessel have here. And also how much trauma, the nerves, the bones. I am going to open and then see. I think the difficult part is to prepare here for operation. Is much more difficult than taking the finger from here to here.
And what it will happen with the...
This is very easy. Good question. I'm going to just close here, a scar tissue like here and scar tissue here, and then he will have like these fingers, the 4 fingers. This patient can run, can jump, play basketball, play football, like 6 months or 1 year later. Yeah, and then these fingers will stay in the shoes. Nobody can understand that he has feeling loss of this finger. No function, no aesthetic, consideration about this.
How much he will recover, how much he will gain back from the movements he did before with a normal hand?
At first, when we do this operation, 5 or 6 days he will stay here. We have to take care that this thumb will alive here. Okay, it's very important, the circulation. If it's okay, after 6 days we will send him home. But when we send him home, we will give him some physical therapy for movement. But 2 months, we are not going to give him like heavy things to move. Just we will have a splint here, just small movement, some physical therapy. After 2 months, we are going to give him some functional, like he can put some light things. But after 6 months, he will use his hand as strong as the normal
everybody.
hand. Yeah, normal hand. But during these 6 months, we have to give him physical therapy and some also exercise to bring his finger stronger.
Today is for you a challenge, as I understand. It's not an ordinary reconstruction surgery. It's something special.
Yeah. Today, it's not usual operation. We are doing very seldom this kind of surgery. But we do here in the year maybe 2 or 3 cases. And in the world also it's not too much done. So it's a special day for us. Yeah.
I really wish you good luck, both of you.
Okay.
And as I see, he trusts you.
Yeah.
Full trust.
Okay.
So I let you to have your own words.
2 ay sonra artık kendi yemeğini kendin yiyeceksin, tamam mı? Bu elini kullanacaksın. Ben ona inanıyorum. Tamam mı? Hadi. Hadi bakalım. Hadi.
Okay.
Thank you for coming here. Okay,
Thank you.
very much.
Thank you.
thank you very much that you stay with us some minutes after this really hard day for you. Around 8 hours in the surgery room.
Yeah, 8-hour surgery, but we have done like 7 hours, something like this. But everything is fine now. So we will follow up the patient like 5 days and give some medications and also to see the circulation of the thumb. It looks fine now, but we have to be careful for 24 hours. It's very important, and they are like vessels 1 millimeter that we have done, and then the circulation have to go inside of this. No any blockage, no any thrombosis have to be. So we have to follow him like 24 hours very careful, and then and after that like 5 days or 6 days in hospital, and then we send him home with some physical therapy. So,
he's young and he's strong as a person.
I think everything
his family is waiting for him with big emotions. And are you aware that for people like him, you are simply the hero of their lives? You know? How do you feel?
For us, sometimes doing this kind of surgery, there are 2 types of surgeries. One that we usually do, the usual things, they are done every day. But this kind of surgery make our feelings very high. I am very happy with my surgery, my technical that I have done. It's good feeling for us also. It's good feeling that know that there is a finger that he cannot use. Now after this surgery he can have a finger that he can use for his life, and it's very important for me also.
Thank you very much.
Okay.
I wish you all the best, and we are waiting for you in a short time again in Romania. Because Romanian patients need you also.
Okay, thank you very much. Thank you very much. I will. Thank you.